So bunions are another really sort of common thing that I see with patients. And many people have a bunion and they may not know what to do about it, what may cause it, and whether or not it's something that they can actually improve on themselves. So the great thing about bunions is that there's a lot that you can actually do to improve your bunion, whether that's through strengthening your foot, sort of making some changes with your footwear can be really helpful, and also thinking about just the overall mechanics of your body and what kind of movement patterns you have. So the first thing that I would do if you suspect that you have a bunion would be to just take a look at your foot. If you kind of would to look at your big toe, usually a bunion is going to present as sort of a deviation of the big toe, and it will kind of push in a little bit towards the second toe. So you'll get a little bit of angulation here. A lot of times people will notice that they have a bump on the inside of the foot here, which might be the first thing that sort of draws their attention to it. A lot of patients will get pain either at the bump, or they actually might just feel pain sort of around the big toe in general and may not know what's causing that. So if you're noticing some of these things, it very well may be that you have a bunion or that you're starting to develop a bunion. So the first thing that I usually look at with bunions is how well are you able to move your big toe joint. So if you were to think about the big toe here, how easy is it for you to kind of move that toe up and down? Is it really stiff? Is it hard to move it? Or is it pretty fluid and easy to move each direction? That's a really important factor in how efficiently you can move and how well you're going to be able to kind of support and strengthen your bunion. So the first thing that I usually have patients do when they have a bunion or if they're having symptoms with it is to work on mobilizing the joint. So kind of thinking about getting that range of motion as efficient as possible. So we want to encourage that big toe to be able to extend and flex really easily. The second thing that we'll think about is going to be how much space can we create in between the big toe and the second toe. So if you're somebody that has a bunion and your toe is kind of pushing this way, we want to open up some space here so that we can get that big toe back into a better alignment. The first thing I would recommend for this are toe spacers. So with a toe spacer, what we can do is basically recreate that space in between our big toe and our second toe. So not only will this put your big toe into a better position, it will also start to make the functionality of the forefoot here a little bit better. So now we'll be able to engage the muscles that sort of counteract the bunion, and we'll be able to strengthen into the stabilizer muscles, so the muscles that live in the bottom of the foot. So toe spacers are a really great first step. If you have a bunion or suspect you have one, you can start wearing them as much as you can tolerate them and kind of slowly wear them for, maybe walking around your house or just kind of doing some barefoot workouts and things like that. The other thing I would start to do is to think about strengthening your bunion. So again, we have a lot of muscles that sort of connect into the big toe here. And one of the more underlying factors of a bunion is that we develop an imbalance. So the muscle on the inside of the big toe here gets really strong. We start to pull the toe out of alignment, and the muscle on the outside here gets weak, and we aren't able to pull that big toe back in the other direction. So a really helpful tool for that is the toe band. This is excellent for starting to mobilize your big toe, get some strength into the big toe. One of my favorite exercises for this is to use the band and give yourself some resistance on your toe and start working on bringing that toe out and in. Out and in, and then we can also use the band to kind of work on strengthening in the bottom direction, so plantar flexing our big toe and also extending our big toe. All right, so if you have a bunion, the toe spacers are a really great place to start. Starting to work on just mobilizing, manual mobilization, strengthening the muscles around your bunion is also a great thing that you can do on your own at home. But also if you're having trouble with your bunion, or especially if you're having a lot of pain with it, the next thing that I would recommend would just be checking in with a specialist, talking to somebody who can get a little bit more information about your particular bunion, and look at some of the other underlying mechanical reasons why it might be happening.